Is there a
And
level of uric acid that patients should be aware of, the threshold that it should be lower than a particular
6.
number? 6.
Right.
This is a very important point
Hmm.
because many
Hmm.
lab ranges will say 7.5 is still in the normal range, but anyone with gout history, most of the
Yeah. So,
rheumatologists recommend to have it below
right.
6
Long term.
long term.
Right.
Hmm.
So you don't want to add one of those drugs that lowers uric acid during an acute episode because then you're
Hmm.
just making it worse.
Right.
So sometimes I see people who have an acute episode and they're going to the emergency room and they're telling them to start taking allopurinol or
Yeah.
increase it. You don't want to do that because that will just make the matters worse because you're getting more shifts.
Right.
The,
Yeah.
the uric acid's going down. There's more the uric acid coming out of the tissues into the serum.
Yeah. Yeah. So at that
So,
point, you're actually what you told us, the NSAIDs, corticosteroids,
right.
or
Yeah.
the colchicine.
Right. So you make sure it dies down. You treat the
Mm.
inflammation. You don't want to start anything new
Mm.
until it's really died down.
Mm.
Okay. And then the goal in the long term is to lower uric acid because with
Hmm.
time, that uric acid that's been deposited out in all these tissues will slowly come back, will kind of remove itself from the
Yeah.
tissues and come back into the serum.